Welcome to this explainer. Okay, if you are watching this on our landing page right now, you are exactly where you need to be. I am so pumped to walk you through this because what we've got here is a direct path to a brand new, highly stable career in healthcare. And the absolute best part? No four-year lecture halls required. Today, we're going to break down exactly how you can make this happen through the CBCS certification and how the completely free tools right here on this page are going to get you right across that finish line. Let's just kick things off by busting a massive myth that honestly holds so many talented people back. You absolutely do not need a four-year degree to start a career in healthcare. I mean, society always kind of tells us that breaking into the medical field means years of grueling college, tons of student debt, and just endless prerequisites. But that is simply not true. You can bypass that whole traditional system and step right into a really crucial, respected medical role just through targeted certification. And look, just in case you're thinking that skipping a four-year degree means taking a hit on your earning potential, think about this number: $67,000. While the median salary in this general field hovers around $50,000 a year, folks who go that extra mile to become certified specialists can pull in closer to $67,000 annually. To put that into perspective, that's a fantastic, livable wage for a career path you can start prepping for today, literally without taking out a single student loan. But it's not even just about the paycheck, right? It's about the sheer scale of opportunity. 14,000. That is the number of brand new job openings in this specific field every single year. You know, it's one thing to find a job that pays well, but it's a whole other ballgame to find one where your skills are actually in super high demand. The healthcare system's huge, it's always growing, and as we'll see in a second, this specific role is basically the engine keeping the whole thing running. So let's look at the CBCICS career opportunity and figure out what exactly is this role. Okay, so CBCS stands for Certified Billing and Coding Specialist, and this isn't just some random piece of paper. It's a nationally recognized credential from the NHA, the National Healthcare Association. Simply put, you are the financial engine of healthcare. Think about it. Every single time a patient visits a doctor, goes to the ER, or hops on a telehealth call, somebody has to translate those visit notes into very specific diagnosis and procedure codes. Then, those codes get used to submit claims to insurance companies. Without the CBCS, the entire financial side of healthcare would literally grind to a halt. You're basically the ultimate translator between the medical provider and the insurance payer. Which brings us to a really crucial realization. Healthcare doesn't stop during a recession. Right? When the economy dips, people still get sick, babies are still being born, and preventative care is still a total necessity. This makes a career as a CBCS incredibly stable. It's practically recession-proof. You're locking down a role in an industry that functions as a baseline necessity for society. That means serious peace of mind when it comes to your job security. Moving right along, is this for you? Let's break down the actual requirements. So the accessibility here is just wild. To get started, your educational baseline is literally just a high school diploma or a GED. That's it. Beyond that, you just need to complete a training program, or if you already have your foot in the door, just 1 year of on-the-job experience in the field. This is exactly why the certification is so incredibly popular with career changers, folks re-entering the workforce, or honestly anyone who just wants a stable medical career without losing years to a university. But let's ask the real question here. Do you, personally, have what it takes? The educational barrier to entry is super low, sure, but the work itself? It definitely requires some specific personal traits. Are you naturally organized? Do you sweat the small details? Because in this line of work, a single misplaced digit in a medical code can literally be the difference between a paid hospital bill and a totally rejected claim. Are you willing to learn medical terminology and new coding systems? If you're organized and eager to learn, this highly attainable career is going to be an absolute perfect fit for you. All right, next up, breaking down the exam. What should you actually expect on test day? Let's walk through these straightforward mechanics of test day. Look, testing can cause a ton of anxiety, I totally get it. But there is absolutely nothing to fear here. The CBCS exam is just 110 questions, you'll get 1 hour and 50 minutes total to knock it out, and the cost? It's insanely affordable. The exam fee is just $117. When you compare that to a single college credit, let alone a whole degree, that is an incredible value for a nationally recognized credential that pushes your earning potential up near $70,000. The exam itself is chopped up into 4 really clear, conquerable sections. You've got billing at 32%, regulatory compliance at 24%, claims processing at 22%, and front-end duties wrapping it up with the final 22%. By understanding this breakdown, you know exactly where to funnel your study time. Let's do a really quick dive into what's inside each of these slices. First up is billing. This is the biggest chunk of the whole exam at 32%. This is where they test the core terminology and the coding workflows you're going to use every single day on the job. You'll need to show you grasp basic medical terminology, so you actually understand what the doctors are scribbling down. You'll be working with ICD-10 diagnosis codes, which explain why the patient was seen, and CPT and HCPCS codes, which explain what procedures were actually done. Basically, it's all about understanding that seamless flow of how a patient's visit transforms into a real, tangible charge. Next is regulatory compliance, sitting at 24%. I actually like to call this the Know the Rules section. Healthcare is heavily regulated to protect patients, as it absolutely should be. So here, you'll be tested on HIPAA privacy and security rules to make sure patient data stays totally confidential. You'll also need to wrap your head around fraud and abuse laws to ensure billing is ethical, along with CMS documentation requirements. It's really all about playing by the rules to protect both the patient and the practice. Then we've got claims processing, making up 22% of the test. This section is super practical. It's testing your ability to actually execute the administrative side of the job. You'll be tested on how to properly fill out CMS 1500 forms. Those are the standard claim forms used by the pros. You got to know the protocols for submitting electronic claims, how to read an explanation of benefits, and honestly, perhaps most importantly, how to handle claim denials. Knowing exactly what to do when an insurance company says no is a massive, massive part of a specialist's value. Finally, rounding out the last 22% of the exam, we have front-end duties. This covers all that critical stuff that happens before the billing process even officially kicks off. We're talking verifying a patient's insurance coverage before they even step foot in the doctor's office, securing prior authorizations from insurance companies for specific procedures, and managing that initial patient intake. If this front-end data isn't perfectly accurate, the back-end billing is going to fail. So yeah, this is a vital part of the exam. Okay, prep for free today. Let's talk about your tools for success. So traditionally, if you wanted to prepare for this exam, you kind of had to pay out of pocket for a super expensive boot camp. And those boot camps, they typically run anywhere from $500 to $2,000. But we've built something totally different here. Instead of charging you, this page gives you 20 specialized AI tutors, completely 100% free. You are getting elite, personalized exam prep without that crazy, prohibitive price tag. Let me just quickly explain how powerful these tools are. We aren't just giving you some generic chatbot. We've built 20 specialized AI tutors, and each one is mapped directly to a specific exam topic. For instance, if you're struggling with that claims processing section we just talked about, you can work specifically with the denial management tutor, or dive deep with the ICD-10 coding tutor. You can ask them questions, work through real-world medical billing scenarios, and practice entirely at your own pace. And the best part? These tutors actually have memory. They learn with you. When you come back tomorrow, they remember exactly where you left off. They give you practice questions with instant feedback, pinpointing exactly where you're strong and where you maybe need a little more focus. It's a real game changer. Because we really want to remove every single barrier in your way, the preparation on this page is entirely free. You aren't going to hit some surprise paywall halfway through your studying. You only make a financial commitment, that $117 exam fee we mentioned earlier, when you are fully prepared, confident, and absolutely ready to sit for the official NHA test. Your learning environment right here is completely risk-free. So how do you actually get going? It's just 3 steps. Step 1. Click the Start My Free Cert Prep button right here on the page. Step 2. Pick whatever topic you want to start with. Maybe tackle medical terminology first. Step 3. Start chatting with your AI tutor. You don't even need to set up an account right away. You can jump right in using guest mode just to see how powerful this is for yourself. We've covered a lot of ground today, but the main takeaway is that a stable, lucrative career in healthcare is significantly closer and way more attainable than you probably ever thought possible. You've got the blueprint, you know the requirements, and the free tools are literally right at your fingertips. So my final question to you is this. What topic are you going to ask your AI tutor about first? Scroll down, click Start, and take that first step toward your new career right now.